Have you ever wondered what's really going on inside your body, especially at this age, when we begin to understand our health in a deeper way than we ever did in our younger years? I've had countless one-on-one conversations with my patients, men in their 50s, 60s, even into their 70s, and there's one question that keeps coming up. Sometimes it's asked in a quiet voice, a little hesitant, maybe even a bit embarrassed. "Doctor, should I be worried if I masturbate often?" One of my patients, he was in his early 60s, once sat across from me looking deeply concerned. He said, "I haven't dared to ask anyone this, Rose. I've heard all kinds of things, that it's bad for the kidneys, it causes erectile dysfunction, maybe even cancer. But then I've also heard it helps with stress." I gently held his hand and said to him honestly, that's not just a valid question, it's an important one. And if you're watching this video right now, I believe, you might be quietly wondering the same thing too. Now, today's topic might feel a little delicate, but I want you to know it matters. Because prostate health isn't something distant. It's not something for someone else or at a certain age. It's about you. It's about me. It's about every man who wants to live well and age with peace. I'm Dr. Rose, a men's health specialist with over 20 years of experience working with thousands of middle-aged and older men here in the US. And today, I want to share with you what modern science, not rumors, is saying about daily masturbation and its real impact on the prostate. Let me begin with this. Masturbation is not wrong. It doesn't make you less of a man. It doesn't weaken you. And it certainly doesn't take away your worth, no matter what you might have been told. In fact, did you know a major study from Harvard, where I trained in male endocrinology, followed over 31,000 men for 18 years? They found something remarkable. Men who ejaculated at least 21 times a month had a 31% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times. Now maybe you're thinking, that could just be coincidence, right? That's what I thought too, until researchers explained why. Regular ejaculation, it turns out, helps clean out the prostate. It flushes away inflammatory substances that, if left to build up, may increase the risk of disease. Think of it like running water through a pipe, keeping it clear flowing and free of buildup. Your prostate works in a similar way. But don't get me wrong, I'm not saying the more the better. I'm not here to tell you to turn this into a routine or obligation. What I do want is for you to understand your body, to trust it, to stop seeing your natural instincts as something to suppress or feel ashamed of, and instead to listen to them, to understand them, and to care for them in a healthy, balanced way. Because every man carries a story of pressures, of expectations, of things he's never said out loud. But your health, especially your prostate health, should never be one of the things you hide from. In this video, I'm going to help you understand when masturbation can actually benefit your prostate, when it might be a sign of something to pay closer attention to, and most importantly, how to keep your prostate healthy naturally and sustainably. We're going to break myths. We're going to look at the facts, and together, we'll find what's right for you. I invite you to stay with me, to listen, to learn, and to care for yourself with kindness and compassion. Have you ever felt awkward, even thinking about this topic? If so, you're not alone. And that is exactly why I'm here. If you're ready, let's begin. I'm Dr. Rose, and this is a space where your voice matters. 1. Is daily masturbation harmful or helpful for the prostate? There's a question I've heard more times than I can count, though rarely spoken out loud. One of my patients in his early 60s, taxis, once looked at me and hesitantly asked, "Doctor, I masturbate every day. Could that be bad for my prostate?" I smiled and told him, "That's not just a fair question, it's one that absolutely deserves a real answer. You see, even though masturbation is a completely natural part of being human, it's still surrounded by so much fear, shame, and misinformation. Some say it weakens men. Others blame it for everything from infertility to cancer. But the truth is, modern science tells a very different story. One large study from Harvard followed over 31,000 men for 18 years. And what they found was eye-opening. Men who ejaculated at least 21 times per month had a 31% lower risk of developing prostate cancer compared to those who did it less frequently. Why? Because regular ejaculation may help flush out inflammatory substances that can build up in the prostate. Think of it like keeping the pipes in your house clear. It helps everything flow more smoothly, preventing blockages. But the benefits don't stop there. Reaching orgasm also triggers a release of feel-good hormones like oxytocin and endorphins, which naturally reduce stress, lower blood pressure, and improve sleep quality. Here's what I want you to remember. Masturbation, when done mindfully and not compulsively, is not harmful. In fact, it can be a healthy part of life, especially as we enter the stage of life where both physical and emotional well-being need more care than ever. You don't need to feel ashamed of your body. Listen to it, understand it, and care for it with kindness. That's what matters most. The benefits of masturbation for prostate health. I want you to picture this. The prostate is like a little valve about the size of a walnut, sitting right at the center of your reproductive system. It may be small, but its role is huge. It helps produce the fluid that carries and nourishes sperm and supports both sexual and hormonal health. When you're young, you barely notice it. But once you hit middle age, it starts to speak up sometimes, with nighttime urination, heaviness in the lower belly, or in more serious cases, prostate cancer. Here's the interesting part. One of the most natural ways to keep your prostate functioning well is regular ejaculation. Whether through masturbation or sex, this simple act helps prevent chronic inflammation in the prostate. Every time you ejaculate, your body is cleaning house, clearing out waste compounds that, if left unchecked, can cause irritation and long-term damage. The pleasure of orgasm also triggers oxytocin, that calming, peaceful hormone, while lowering cortisol, the body's main stress hormone. That balance can help stabilize testosterone, improve immunity, and even support mood. In fact, studies show that men with regular sexual activity tend to sleep better, have steadier blood pressure, and feel more emotionally balanced. And as you probably know, those things are closely tied to longevity. Now, I'm not saying masturbation is some magic cure for everything, but I am saying it's a natural part of who you are. And when practiced with awareness and balance, it can absolutely support your health. If more men learn to treat themselves gently, to listen without shame, then sexuality, whether solo or shared, could be seen for what it truly is. A valuable part of caring for ourselves as we age. 2. What the prostate actually does. Some parts of our body work so quietly in the background, we forget they're even there. The prostate is a perfect example. You may have heard of it usually during annual checkups or when your doctor says it's time for a prostate screening. But what is the prostate really? What does it do for us? And why is it so important? The prostate is a small gland about the size of a walnut, sitting just below your bladder. It wraps around the urethra, the tube that carries both urine and semen out of the body. Despite its size, it plays a massive role. It produces most of the fluid that makes up semen, the fluid that protects and transports sperm during ejaculation. Without the prostate, sperm wouldn't have a way to travel. And if the prostate becomes inflamed, enlarged, or cancerous, everything from your sexual health to your urinary function and overall quality of life can be affected. One of my patients, 65 years old, once told me, "Doctor, I had no idea that tiny gland could keep me up at night, make me pee 10 times, and leave me exhausted the next day." He wasn't exaggerating. When the prostate swells, whether from age, hormonal changes, or other causes, it presses against the bladder, making urination difficult or painful. That's why so many older men complain about frequent nighttime urination or feeling like they can't fully empty their bladder. Even more concerning, prostate cancer, one of the most common cancers in men over 50. The good news is when caught early, it's often very treatable. So don't underestimate the prostate just because it's small. Inside a man's body, it's like a gatekeeper regulating, coordinating, and protecting the balance of your reproductive and urinary systems. To understand it, to care for it, is to care for your whole self, especially as we step into this powerful season chapter of life. 3. So, what does the science say? I get it, this topic can feel a little awkward to bring up. But deep down, a lot of men are quietly wondering the same thing. If I masturbate every day, is that bad for my prostate, or could it actually be good for me? Well, the answer isn't based on guesswork or old wives' tales. It's rooted in serious science. We're talking about long-term studies done by real researchers over decades. One of the most well-known studies came out of Harvard Medical School. They followed nearly 30,000 men over many years and found something fascinating. Men who ejaculated regularly, about 21 times per month, had around a 20% lower risk of developing prostate cancer compared to those who ejaculated less often. Why does that happen? Well, every time you ejaculate, your prostate clears out old fluids. That helps reduce the buildup of toxins and lowers inflammation. In simple terms, moderate masturbation acts like a natural internal rinse for the prostate. But here's the key point I want you to take away. There's a big difference between healthy frequency and compulsive behavior. When you're relaxed in a good mental space and masturbation fits naturally into your routine, it can be beneficial. But when it becomes obsessive, stressful, or starts interfering with your daily life or relationships, that's when we need to pay attention. Another myth worth busting: masturbation doesn't reduce testosterone. It doesn't cause infertility. And no, it does not shrink the prostate. In fact, not ejaculating for long periods can actually lead to fluid buildup in the prostate, increasing the risk of inflammation, discomfort, and even urination issues. I often tell my patients, your body doesn't lie. If you feel good, sleep well, and feel mentally clear after masturbating, you're probably doing it in a healthy way. But what science really emphasizes is this: listen to your body, don't force anything, don't feel ashamed, and don't do it out of habit or guilt. Treat it as a natural part of your sexual health, especially as you get older and want to stay balanced both physically and emotionally. 4. The benefits of masturbation. Now, I know even just hearing the word masturbation makes some people squirm a little. I've had patients ask me, "Doctor, is it normal to still do that at my age?" And I always smile and say, absolutely normal. In fact, in many cases, it's even good for your health. Let me break it down for you. Benefit 1. It may reduce the risk of prostate inflammation. When you ejaculate, whether through sex or masturbation, the prostate clears out built-up fluids. This helps prevent things like pelvic pain, inflammation, or trouble urinating. Benefit 2. It reduces stress and helps you sleep better. After orgasm, your body releases oxytocin and endorphins, your natural feel-good chemicals. They help you relax, ease pain, and wind down, which is especially helpful if you're struggling with sleep. And unlike pills, there are no side effects. Benefit 3. It improves circulation in the pelvic area. Healthy blood flow to the prostate and pelvic muscles is essential for both urinary and sexual function. Regular stimulation keeps things moving and may even help prevent certain urologic conditions. Benefit 4. It helps you get to know your own body. Through self-touch, you become more aware of changes like differences in sensation, erectile function, or pain. This awareness can help you catch early signs if something's off and get checked sooner rather than later. Now let me be clear. Masturbation is only helpful when done in a relaxed, healthy way. If it becomes compulsive, or if you're using it as the only way to cope with boredom or stress, then that's something to take a closer look at. But the act itself, There's nothing shameful about taking care of your sexual health, whether you're 50, 60, or 70. What matters most is understanding, accepting, and respecting your body a little more each day. 5. Breaking the myths. You know, I believe the thing that really makes older men worry about masturbation isn't the act itself, it's the myths they've carried with them since they were young. Stories passed down from friends, schoolyard rumors, things no one ever really explained. So today, let's clear the air. Let's bust a few harmful myths that have made a lot of good men feel guilt or shame sometimes for decades. Myth 1. Masturbation causes erectile dysfunction. Not true. There is zero scientific evidence that masturbation causes ED or premature ejaculation. In fact, when done in moderation, it can help keep the pelvic nerves and blood vessels in good shape. Myth 2. Masturbation shrinks your testicles or makes you infertile. Ever heard someone say, if you do it too much, your testicles will shrink? That's just not how it works. Testicle size only changes due to medical conditions, like varicocele hormone imbalances or injury. Masturbation has nothing to do with it. Myth 3. Older men shouldn't masturbate. Says who? If you still feel desire, if your body still responds to pleasure, then you absolutely have the right to care for your sexual health, safely, privately, confidently. Myth 4. Masturbation is dirty, shameful, or sinful. I've met many patients who hide this part of themselves. Some feel ashamed, some beat themselves up about it. But modern medicine says clearly, masturbation is a natural biological function. Just like you eat when you're hungry, or sleep when you're tired, satisfying sexual tension in a healthy way is a normal part of being human. And no, it's not bad. Done with self-respect and care, it's actually part of staying emotionally and physically balanced throughout life. We can't go back and erase the old beliefs we were taught, but we can start healing from them. 6. When does masturbation become too much? Like I've said before, masturbation is completely natural. But just like anything else, too much of a good thing can throw your system off balance. So how do you know when it's crossed the line? 1. When it starts affecting your daily life. If you find yourself skipping work, ignoring responsibilities, avoiding friends or family, just so you can be alone and masturbate, that's no longer relaxation. That's an obsession. 2. When you can't control the urge. You try to take a break for a few days, but feel irritable, restless, even anxious. It's all you can think about. That's not physical need, that's a mental loop. And it might be a sign of mild behavioral addiction. 3. When it leaves you feeling ashamed or guilty. Some men finish and immediately feel disgusted with themselves, like they've done something wrong, like they're broken or perverted. If you're stuck in that cycle, the issue isn't the behavior, it's what's going on inside emotionally. And that deserves your compassion, not your judgment. 4. When it impacts your physical or mental health. Too much masturbation can leave some men feeling drained, sleep-deprived, or disconnected from their partner. Sometimes it's a symptom of deeper emotional struggles like loneliness, mild depression, or unresolved sadness. Masturbation isn't the problem, unless it's making you suffer. If you're starting to question your habits, if they're hurting your quality of life, don't be afraid to talk to a doctor, because sexual health. It's not just for young people, it's part of your whole health, your dignity, your vitality, your self-respect at every age. 7. 5. Simple tips to protect your prostate. You know, no matter how old you are, you can still take care of your prostate, naturally, affordably, and without much hassle. Here are 5 simple but powerful habits to help keep your prostate healthy as the years go by. 1. Eat more anti-inflammatory foods. Dark leafy greens, tomatoes, berries, like blueberries, soy, and flax seeds. They're packed with antioxidants that help fight inflammation. And inflammation, as we know, is at the root of many prostate issues, including enlargement and even cancer. Bonus tip: lycopene. The nutrient in tomatoes has been studied specifically for prostate health. 2. Keep a regular sexual routine, even if that means healthy masturbation. Men who ejaculate regularly, about 2 to 4 times a week, tend to have a lower risk of prostate cancer. Why? Because regular ejaculation helps flush out old fluids and potential toxins. But hey, don't force it. The key is to listen to your body and go with what feels natural. 3. Drink enough water, but ease up at night. Staying hydrated during the day helps your body eliminate waste through urine. But after 7 p.m., try to cut back a bit. Too much nighttime urination can disrupt your sleep and put extra stress on the bladder and prostate. 4. Get some light movement in every day. A brisk walk, easy biking, swimming, or gentle yoga. They're not just good for your heart, they also boost circulation in the pelvic area. Better blood flow means your prostate gets the nutrients and oxygen it needs to stay healthy and avoid chronic inflammation. 5. Don't skip your checkups. Look, I get it, talking about this stuff isn't always easy. But if you're over 50, a yearly prostate exam is one of the smartest things you can do. Whether it's a PSA blood test, an ultrasound, or just a simple clinical exam, it can catch problems early before they become serious. Your prostate may be small, but it plays a big role, not just when you're young, but all throughout life. Take care of it, and it will quietly take care of you. You know, sometimes it's the quietest things in our body that matter the most, and the prostate is one of them. It works silently for years, asking for nothing. But once you hit your 50s, 60s, 70s, it'll let you know if it's been ignored. But here's the good news. Caring for your prostate isn't hard. You just need to understand its role, let go of the old myths, and most importantly, listen to your body. In this video, we've talked about how healthy masturbation can actually help your prostate, what science really says about it, and how to recognize when too much becomes unhealthy. My hope is that after today, you'll feel less awkward about talking or even just thinking about your prostate and your sexual health. Because your body, it deserves to be understood and loved fully at any age. So start today. Whether you're 50 or 80, it's never too late to care for yourself with kindness. Thanks for watching, and thank you for showing up for your health. If you found this video helpful, consider sharing it with someone you care about. It might just be the health gift they've been waiting for. Take care, and I'll see you in the next video. Live healthy, live with self-awareness, because aging isn't an end, it's a privilege.